They said the German Shepherd was obsessed with the toddler's leg. They said it was a dominance thing. It wasn't dominance. It was a diagnosis 4 weeks before anyone ran a single test. It started the way something always starts when you're not looking for it. Nadia Kowalczyk was doing laundry on a Thursday when she heard her German Shepherd, 6-year-old Aries, make the low specific sound he made when something in the house required her attention. Not barking. The sound below that, deliberate, directional. She came to the living room. 2-year-old Dani was standing at the toy shelf. Aries was beside her, nose pressed to her left knee, holding it there, not nuzzling, not playing, holding his nose in one precise location on the side of her knee, unmoving. Dani looked at him with the mild interest of a toddler who is accustomed to dog contact and has not yet decided whether to engage. She didn't pull away, she didn't react. She was not in any visible way in pain. Nadia said, "Aries, off." He pulled back. He sat. He looked at Dani's knee. He looked at Nadia. He pressed his nose back to the knee. She moved him again. He returned. She filed it under dog being strange. She had 20 minutes before the dryer needed attending. He was at Dani's knee every day for the next 4 days. Not continuously, in the way of a dog doing a specific check on a regular schedule, in the mornings, after naps, whenever Dani was stationary enough to allow it. He pressed his nose to the same location on the left knee each time. He held it for 3 to 7 seconds. He pulled back and looked at Nadia. On day 4, she looked at the knee herself. Nothing visible. The skin was normal color. No swelling, no bruising. Dani walked normally. She had not been limping, had not favored one leg, had not cried when Nadia dressed her or bathed her. She had no fever. She had been eating normally. On day 5, Nadia mentioned it to her husband Pavel over dinner. Pavel watched Aries do the knee check after dinner. He said, "How long?" 5 days? She said. He said, "Has she been limping?" "No," Nadia said. He thought about it for 2 days. On day 7, he said, "Call the pediatrician." Nadia called. She described the dog's behavior. There was a pause on the line. The nurse said, "Come in tomorrow." Subscribe now before the next paragraph. Because what the MRI showed on day 11 when the pediatric orthopedist ordered imaging after the blood work came back with elevated inflammatory markers confirmed something that a 6-year-old German Shepherd had apparently been reading through his nose for more than a week before a single instrument in that clinic registered any signal at all. Dani had early-stage osteomyelitis, a bacterial bone infection in the proximal tibia of her left leg, the bone directly beneath the spot Aries had been pressing his nose to for 11 days. The infection was in its early stage. There was no visible swelling, no skin change, no fever. All the markers a parent looks for, none of them yet present. The infection was inside the bone, producing the chemical signature of bacterial activity and early inflammatory response in the tissue surrounding it. At the surface, invisible. In the air of the room, in the compounds carried by blood flow to the skin surface above the infection site, present at concentrations detectable by a dog whose nose was pressed to exactly the right location. Dr. Marta Voss, pediatric orthopedics, told Nadia, osteomyelitis in toddlers is difficult to catch early because the initial symptom presentation is minimal or absent. By the time fever and obvious pain appear, the infection has typically been establishing for weeks. The standard of care is IV antibiotics begun early. The earlier the better because an untreated bone infection at this stage can cause permanent growth plate damage. She looked at Aries, who was with them in the room because Nadia had not thought to leave him in the car. She said, "How long did you say the dog had been doing this?" 11 days, Nadia said. Dr. Voss wrote something down. She said, "Your dog started alerting approximately 9 days before your blood work gave us enough elevation to prompt imaging." That is not a small number. Has your dog ever returned repeatedly to the same specific spot on your child's body? Tell us in the comments. These stories deserve to be heard. Dani completed a course of IV antibiotics followed by oral antibiotics over 6 weeks. Her infection resolved without growth plate involvement. She walks normally. She runs specifically at a velocity her parents describe as a public safety matter. Aries no longer goes to her left knee. The thing he was reading there is gone. He checks her the way he checks everyone in the house. A quick nose pass when she comes into a room, thorough and routine, the physical accounting of a dog who has decided that his job is to know what is happening in the bodies around him. Every guardian deserves to be recognized, even the ones who never asked for anything in return. If stories like this matter to you, subscribe so you never miss the next one. If you stay for stories about what animals sense before we do, stories about the guardians who find what our instruments miss, you're in the right place. Subscribe so you don't miss the next one. Nadia thinks about 11 days. She thinks about the week she filed it under strange and the days it took Pavel to say call someone. She thinks about growth plate damage, which Dr. Voss had described as the outcome they had been trying to prevent, and which they had prevented because a 6-year-old German shepherd had pressed his nose to the left knee of a 2-year-old 11 days in a row, and looked at Nadia each time he did it. She said sorry to him once for not calling sooner. She said it in the kitchen at night when no one was listening. He pressed his head against her hand and exhaled and said nothing, which is all he has ever needed to say. Next, the golden retriever who started sleeping across the threshold of a specific bedroom door, the room nobody was sleeping in, for 6 nights before anyone thought to check what was accumulating on the other side of it.